is a focus for our state. So they decided to have available resources, kind of a box with some contraceptives and some resources for preventing STIs and also resources for pregnancy that got sent out. As of yesterday, Governor Whitmer actually made an announcement that there are 300 of those across the state of Michigan, and they've reached every county in Michigan packets. So we do have a package at our health department. She calls her program Take Control of Your Birth Control. It comes with condoms in the packet. It also comes with an O pill, which is a progesterone only birth control pill that is not for the counter. So you can go purchase that at Walmart or wherever you would like to purchase that for about $20 a month. It comes with what we call an emergency contraceptive pill and some family planning educational resources. So we have written materials for patients. We have some kind of scripted materials. We have some things we can put on social media. So this was all kind of drawn up in October, and by November, which is the month that this is supposed to take place, we are empowered to use those resources. And then once those resources are gone, we can also help people with a Plan First program where they can continue. We can help them with their insurance or lack thereof insurance, and we can help them get additional resources if needed. So you can see in my report, I won't go through all of the potential contraceptive resources that we could have, but again, there are condoms in there, which we already also give out at all of our health departments with some resources also with those. And then there's this progestin only pill. It's under oral contraceptives, and that is only progesterone, so a lot safer than the combination oral contraceptives. It has a typical failure rate of 7%. But again, you can purchase those right online. You can actually purchase them on Amazon. You can actually order them off of Amazon. And then it has this emergency contraceptive pill, which I have kind of on the last page under emergency contraception. So it is not a regular form of birth control. People use the emergency contraceptive pill if their birth control fails, if they forgot to use birth control. And it is a pill that you take kind of within several days of your sexual intercourse activity, and it does not affect an existing pregnancy. So if you're already pregnant, this pill will do nothing to that. It will just continue your pregnancy. It is not an abortion pill. So there's a separate, when we talk about that abortion pill, there are abortion pills that you have to get a prescription for. This is not an abortion pill. So you take it and it prevents ovulation, so the egg does not come out as it would normally. And it makes kind of a slightly uncomfortable environment for the egg to come out. So the egg has never been out, it has never been fertilized, it has never been implanted. So it's really not the abortion pill. That's kind of a separate category, which we certainly are going to delve into. And that requires a prescription anyway. So we have this packet. And as do many other people in the county, it's not just health departments. You can get them at federally qualified rural health programs, other health partners, MDHHS. You can go right to the MDHHS office and pick up these materials. So I just wanted to bring that to the forefront because we do have this packet of materials that we did get from DHHS. So that was a push. So you might see that in the media too. She's doing a big push for, being able to choose your birth control, being able to plan your family, so again, not related to abortion. So I feel really comfortable with materials.
Very good. Thank you for your report. Any questions?
Yeah, there's a patient cost and all that, right?
Not with our packet right now, not with our figures right now.
So it's just a government provided.
It is a government provided, those are government provided materials.
Our tax money.
Mr. Chair,
Yes, sir.
I have a question. So, Governor, the administration is going to encourage this as medical professionals. We have to do it, correct? But I thought that we have to spend a substantial amount as a state to improve this in Michigan, I thought. So how does that work?
You have to ask the governor.
This is just for the month of November, to be clear. This is not an ongoing thing. It's a one-time month of November. And the purpose that we were shared is really to promote Plan First, which is a limited Medicaid program for individuals that don't qualify for Medicaid, maybe the full Medicaid benefit, don't have their other private insurance. Plan First is limited to products that would provide family planning. So 1 month promoting Plan First and available at quite a number of locations actually here. And it appears to have been sent to every MDHHS office. So it'll be just down the road from 20 Care Drive. It'll be in Centerville. Not only at the FQHC in Centerville, but also at the MDHHS office. And then there's a private provider in Three Rivers in addition. So there's a map that you can look at that will tell you who the providers are.
So, Mr. Chairman, thank you. That's it. So that means only Thanksgiving holidays.
Sure. What is it about November? Is it a STI HIV month
The
or
kids do come with some applications for that.
Yeah, I don't-
They can continue on their own.
right?
We're just kind of good for stuff, but yeah.
Very good. Any other questions for family planning? Okay, good. We'll move on. Thank you for that again, Dr. Deborah. Reports, health education promotion.
And Chris is on vacation. She's on a boat in the Caribbean. Lucky her. But I wanted to point out just a couple of things. At the end of the meeting today, or after the meeting concludes, there is an education session that is on this grant that we received from the Michigan Office of Highway Safety and Planning that is to address vulnerable roadway users specific to horse and buggy transportation. So we'll talk about that after the meeting concludes today. Josh will come in and provide that presentation for us. There was an initial meeting of the Grant Advisory Committee on November 1st. So that is one of our requirements in the grant is to have the advisory committee. We have representation from each county sheriff's office and road commission, and we are looking to expand that committee as we move forward to include community members and trusted advisors. If you have any suggestions, we'd be happy to take those and share those with Chris. So just let me know. You can notify Chris directly if you would like of anybody that you think would be great for that committee. Other than that, she talks a little bit about that grant we have with Beacon Health. That actually wraps up December 31st. So it was a limited period grant and to support maternal infant health activities. So we have some products that are in baby bags to help with breastfeeding initiation and use for new moms. There was a push for mental health resources and notifying and making sure that residents in that St. Joseph County area know about the mental health department serving all, not just Medicaid people. So that grant is on track to be completed at the end of the year. There was the opioid grant that the county of Hillsdale provided to the agency to put on a community educational opportunity in 2025. So the health education department is working on putting that together for Hillsdale County. She talks a little bit about the news releases that have come out and an update on the community health worker program and who they've served. So if you have any questions or any names for advisory committee members, I'm happy to take those. Yes, we absolutely are.
You're smart.
Yeah, and Commissioner Rosado was at the HSC meeting and came up to Joe, who was attending that for the agency this time, and suggested someone, so that information will go to Chris, so that they can reach out. And then Josh, it's interesting, Josh Engelhardt will be doing the presentation later today as a pastor himself. And so he has an interesting affiliation with bishops. You know, I think it has to do with, you know, you do that kind of work, I do this kind of work, you know. So they seem to be able to have a good conversation.
Questions, how many image you can have on visit today?
Oh, my goodness, no kidding. And they're all a little different, right? So, yeah, I don't know. It'll be interesting to see how it goes.
I don't think they come in anything less than pairs, do they?
Yeah, and how do we get them there? But anyway.
Very good.
Yeah.
Okay, well, we appreciate that. Any questions for Rebecca or Chris in the future, I guess? All right, good. Let's move on to environmental health. Joe, welcome.
Good morning. Thank you.
Good morning.
As Becky kind of alluded to, I'm really excited about a new addition to replace me as I got bumped up to PH director. We've got a person that's we've offered a conditional offer to be the new food supervisor. This person brings tremendous amount of knowledge. The football coach in me gets really excited about a team that you can build up, and you're going to get to see what they're going to do. And I'm really looking forward to that. So we're hoping that'll be mid-December when they're able to begin work with us. In addition to that, I was able to send some of my staff to Kalamazoo to do plan review training. So a big part of what I used to do was people would come in and say, hey, I want to start a restaurant, and they would have plans, and we review them. We look at food safety principles, equipment, menus, all that kind of stuff. So I'm trying to diversify that knowledge within my group so that everybody's able to kind of handle that workload so that we're just more efficient. So we had one staff person from St. Joe and one from Hillsdale attend that, and it was very well received. So that was a good thing. We also had a pool training that Eagle put on for us here in our office. That went very well as well. We had many health departments come in from kind of our surrounding areas. It's a good networking time. It also gave us an opportunity to go to the pool here in Coldwater, which is a very nice pool. Dr. Brown Aquatic Center. I'm very thankful that they allowed us to come in and kind of brought two groups in at different times to be able to walk through and look at their plumbing, the equipment, how the pools operate, heating, how they go, make sure that the sanitizer levels are correct. It was really great. And the state actually was like, I've never seen that before. I didn't know it. So it was good for the state to kind of take a look at that as well. Other areas that we're improving upon, my general supervisor, Kyle Moore, and I have been working diligently to get our QI initiative going, which is we want to make sure that every staff person in environmental health can go up and man the front desk when our clerks are. And that happens, life happens, right? Doctor's appointments, kids, whatever. But it allows us to keep the workflow going. It allows us to do the people's work. So when people come in looking for services, we don't say, well, I can't do that. I don't know. I can't make change or make a receipt or something. Any of those silly questions or answers don't ever happen again. We're able to sit there and do that and keep moving. So it's a big deal. So we started that this week in St. Joseph County. All the staff who have been going through QI training there, which is huge. One of our clerk is going on surgery leave, so we're going to be able to implement that right away starting next week. So I'm excited to see how that works. It just makes us a better team. So that's what we've got going on here.
That'd be easier once the new software is up and running.
I would think that, yeah, that's going to play a big part in it. But it hasn't been implemented yet. So I'm guessing.
Thought that was supposed to be up and running by now.
The software. So it's just the
The software's up and running. Like Hedgehog's moving. The portal, the public facing part of that isn't yet. And that will help. But Hedgehog as a whole, we've been using for it's been a year, so yeah, we're moving right along.
So instead of somebody making an electronic application and it just automatically goes in there, they still make a paper application and we put it in there.
Yep.
And so it will change when this portal is up and running. Hopefully, we'll have people that want to use an electronic method for application.
I think they're going to. It'll just be a change and we'll have to educate, but that's easy. We can do that.
What's delaying that one for that?
That would have been the vendor that was having some issues with some stuff.
How's the software? How is Hedgehog getting software? I know we're kind of going through that transition. And
It is, how to describe it? It's like a TI 85 calculator when you were a kid. You know how to do simple stuff, but it can do way more than that. That's Hedgehog. It can, when we really start to break it down and dive into it, it's going to be able to do so much stuff. Once we figure out how to build our own reports, because it comes with reports, they're very useful. Once we learn how to do that really well, we can make a report that'll help generate all kinds of information. So it's a really big.
are we going through that process of trying to figure out what we can?
Yep, absolutely.
Yeah,
We're
okay.
learning the tutorials and stuff like that. It's you have to have a little bit of a computer programmer in you to do it.
Sure.
But it's very doable. And that was the whole point behind the program, was that we were able to tailor it to our needs.
Good. Any other questions for Joe? All right. Thank you very much. We appreciate that report. Area Agency on Aging, Ms. Laura.
Morning.
Good morning.
Morning. So I did include the fourth quarter final year-end services to victims of elder abuse program reporting. This is just one part of it. The data system that they report in is web-based and all of that has been completed. But you'll see that we served 44 individuals in 2024, which seems low. But the next sentence in my report really gives you a bigger picture, that there were 49 additional people we worked with, talked to, sort of, I guess you could call it pre-screened, if you will. But those individuals either declined services or supports from us, or were technically ineligible based on the grant requirements. So we then, work with them to find other supports and make referrals within the community. It's just, we're not able to count them in our system. So when you look at the full picture, you see that we serve nearly 100 people, and that's significant. 2025 has been strong. We have pretty much the same level of funding as we did last year, and have already worked with 14, and I know they had more reviews just this week. So we're going strong, starting strong again to the fiscal year. Budget updates, we still haven't heard if we will receive another chunk of funding quite yet. I'm assuming we're going to hear something before the Thanksgiving holiday. We're currently working under a continuing resolution that ends toward the end of December. So we're hoping to get maybe 3 months next time, or maybe 4 months to bring us up to speed. And it's just very difficult budget wise and track expenditures, and the reimbursements are, it's just tough. It's not like tough for us and administratively, it's tough on the providers too. So 2024, sort of back to the year-end stuff, we're pretty much all tied up. We have some final reports that we're waiting on from Teresa's team and from her, but we're in really good shape. So so those loose ends are being tightened, and we are ahead of schedule for many of the different projects and fiscal reports that are due. I wanted to highlight that we served 76 participants in the community living program. Again, we screened plenty more. I don't have that particular number at hand, but likely nearly the same amount of screened, but chose not to, or technically weren't as eligible as we would like to see for that program. So we do not have a waiting list, and so we're currently just plugging right along with the community living program. Summarized a little bit of our outreach event activities. A couple of them were new for us this year, the Kalamazoo event and the Branch County Senior Health Fair and Expo was a new event. So we shall see how that, goes as we look at staffing and capacity for next year. But they were good events to participate in. So we likely will, if we have an invitation to go. The Project Connect event is always super productive. Very much our target audience, folks that we might not have seen or talked to before. Excellent representation and organization from Services Commission in conjunction with the veterans service organizations that support St. Joe County veterans. So it's a really great event. They also collaborate with the faith community to offer lunch to the participants. So that's always a draw, and that always gets more people to come. So that's a highlight from that Project Connect event. So it was fun to be kind of across the way from the health department crew. We saw the mobile unit roll up, and it's just a fun day because not many, people are as colorful and known in the community as the health department is. So it's kind of fun. We do still have part-time outreach specialists, and our care consultant position is still there. Have some options there. Again, working with Teresa and the team, budget and some other factors. But currently, just keeping up. Wear multiple hats. And our front desk, if you will, we all answer the phone in our division. So I might get a call from a caregiver to go through our data system and operations. Talk about options, make referrals out, track it, and put it in our system. So, and we've done that for a while, but I think it's a great idea of what you're doing, Joe. And I think we can all learn from some of the things that you might bring out after your QI project was worked on. The last update is related to sort of a monumental shift and a Bureau initiated grant funding opportunity that was just released on November 6th. And the network had no idea the initiative was going to happen. So we're all sort of scrambling to see what sort of answers we can put back to them and answer the grant funding opportunity to sustain one of the most popular programs that has large in part been worked on and have vetted volunteers to provide state health insurance program counseling in Michigan. Currently, it's called the MAP program. In our two counties, we have both Commission on Agings have trained, highly qualified, I would say, and call them professional level volunteers who offer counseling services on health insurance. Anything from if you're, a gajillionaire and need to understand what kind of Medicare supplemental insurances might work for you best, or if you're very low income, they can help you get and apply for the subsidies that are available, pick Part D prescription drug programs, plans, and just weigh all these very heavy options. And they're basically, the state is now saying, nope, the current way that we administer this is going completely out to bid, and we all have to scramble and put together because it was working just fine the way that it was, according to us. Like, we had never been told that it was not been working fine. So we're kind of reeling on that. And then they also lumped in another sort of formal service that they call person-centered options counseling. So this is a more intensive look at more than just health insurance. It's everything related to home and community-based care, Medicaid-funded long-term care, facility-based long-term care, and an options counselor would allow the person that contacted them, say, if we were awarded this grant, to go over and through all of it based on what they're saying that they or their loved ones needing, and to help them make those informed long-term care decisions. So we already do that in our office as well. Much of that for us is done over the telephone or via email because we can talk with a lot of caregivers about options and what eligibility requirements are for certain programs. This just, again, formalizes that, and they want to have a new sort of broad brush state influence on it, to have 800 that hosts and can be sort of a facilitator of some of those calls. So we're in the process of navigating that, trying to determine if we want to work with some of our neighbors that surround us, Kalamazoo County, Barry, Calhoun, and or Region 2 of Always. So it's going to be an interesting few weeks, and with everything on Teresa's plate, to try to put a budget together that's creative and allows for an additional funding source would be wonderful. But we have to do it right. So we're being very careful and cautious as we move forward with that.
Very good.
That's all I have this month for you.
Okay. We appreciate the report. Any questions for Laura?
Oh, and
Jen.
there's a hot Senate bill I make that I actually, because of the elder justice work we've done for a very long time now, sort of I'm tied in with some the Prosecuting Attorneys Association at the state level, the Elder Justice Coalition at the state level, and a couple of other key organizations that sort of collaborating and trying to bring forth a bill to codify the multidisciplinary teams. So in both of our two counties, we call it an interdisciplinary team. Well, this potential legislation would codify it and give it and frame it as in a more formal way in the state of Michigan. So it's kind of an exciting initiative that could be seen as more likely to potentially receive funding down the line, or potentially be used to encourage other counties to get multidisciplinary teams going. So they ask for people to testify, and they asked if I might, if I'd be available. So it's passed through the Senate. It is Senate Bill number 925. If you're interested in looking it up, and it'll be before the House Family, Children's, and Seniors Subcommittee at some point. They're tracking all the Attorney General's office, Prosecuting Attorneys Association, all the different entities that have contributed to the boilerplate at this point. So I just wanted to let you know that we may be advocating for that state level at some point very soon.
Very good.
That's right.
Yep.
The only comment I had, and I know you said the number of individuals helped underneath the services to victims of elder abuse is only 44. I say unfortunately it's 44. I'd really like to see that number decline, meaning that we're not having individuals be abused or be mistreated that are seniors. So
I appreciate that comment and the acknowledgement, Commissioner. The work is very heavy. The work is very there's a lot of emotional trauma that happens with our team. So you just can't believe some of the things that happen and the way people are affected by important people around them. Yeah. Housing still is a considerable issue. I'm sure you see homeless folks that are probably over the age of 55 or 60 all the time. And it breaks my heart every time I see them, which is now at least daily. So many times those folks have a history of trauma, have a history of abuse, neglect, or exploitation. And so, or you can be totally with it and fall in love with somebody, or think that you're married to a celebrity and send them Apple gift cards day after day after day. And then you're 10 grand in the hole and can't pay your prescription drug bill and wondering why. So it's a difficult
Sure.
job.
Yep. And those are the ones that are reported, right? I mean, how many go unreported, unfortunately?
Yeah.
In the finance community, and I'm sure, right, we deal with it quite a bit.
Our financial institutions like Century, like a couple of the credit unions and other entities around us, really participate in our IDTs. So we're very grateful for that. And anytime any of your friends or family, need us, please give us a call. We, no matter how you're affiliated or not at Human Services or, it can affect us all.
Well, we appreciate that report and look forward to your good work going forward too. Moving on to D, personal health and disease prevention. Ms. Height, welcome. Good morning.
A lot of my topics have kind of already been touched on, so I'll just provide some updates. I included the respiratory virus dashboard link, and that's really nice just to go on and see what's going on around here. COVID cases have decreased from the previous week. About a little less than 1,400 cases were reported this past week. Emergency room visits kind of plateaued throughout Michigan. So that's good. We will continue to encourage vaccination and other preventative measures, of course. Regarding flu, we still have plenty of inventory available. The goal in Michigan is 4 million. I checked this morning, about 45. Let's see, I had listed a few of Amanda's outreach events here. I mean, it really is unfortunate. It's good for her, but sad for us because she has kind of built up forward a lot of these different community partners. So it'd be nice to find somebody to replace her soon. I do think it's difficult because it does take someone who has a lot of initiative, autonomy, and I think a lot of these people these days just are, they want to stay in their shell. You know what I mean? So that's going to be kind of difficult to replace. Let's see. My communicable disease nurse, her last day is today. She's part-time. She is leaving because they're like a one multi-family household with one vehicle and going back to school and it's too difficult for her. So that job to be open. The wake when we covered breastfeeding peer. I think we have somebody we're going to reach out to and offer a position for that one as well. Amanda, like I said, she's going to start training in the children's special health care on Monday with Terry. With WIC, not too much to report there. They're also working on their quality improvement project, and that's mainly just to make sure each office is handling everything the same way. So when they go to cover a different location, it's smooth. The COA program, she's with Angela Shed. She's doing great. She's also a real go-getter. We did the superintendent meeting in St. Joe. She's trying to set up some secretary meetings here. She's put together folders just to get the information out. And there is a training today that 3 of us are going to attend. Just kind of what's going on in our community. Hillsdale, they do have an active TB case that Shelby has been working with. She's compliant with her treatment program. She does have 2 small children and a husband that we're also following up on. And she's also treating 1 latent TBI patient. Coldwater, Samantha's been handling 3 latent TB patients. So that's been keeping her busy. And Britassa's case that Dr. Morello touched on, we do currently have 3 in Coldwater. 1 is a young female from Coldwater High School. So she's been working with the principal there. He did send out notification to parents of each school member, just kind of letting them know what it is, what to look for, and how to handle that. So that's kind of what we've been busy with.
Very good. So I appreciate that report. Any questions for Heidi?
See, go ahead. Your WIC program, how much activity have you done with Phoenix Mobility?
The last I checked, not too much. There was a little hiccup that they were working on. And I can't remember something that was. But
So it's kind of working out.
kind of, yeah. There's been a couple, I think, that have utilized it.
Okay, thank you.
Good. On tuberculosis, can you share any thought of how that infection was?
She was from another country, so I am assuming that she probably has latent TB that.
I wonder if we should do an education on TB. Maybe the best. And explain the difference between TB, latent TB, kind of all that, how it manifests.
Is it good?
I could learn from you too.
Good. Any other questions?
You said, thank you, Mr. Chairman. You have mentioned that the individual may have had the disease, preventable disease carried from another part of the world. My impression was before we entered the country, we had TB, all the communicable diseases, plus X-ray, all kinds of things. You don't do it anymore?
I think it depends on how you're coming into the country. Different categories, different things. But currently, two that we have here in Coldwater, that's kind of how we got them. They had some positive labs, and we have to follow them. And I have X-rays, treatment if needed. So I'm not sure exactly how she came into the country.
I think
I don't know either.
Mr. Chairman, I know we are not addressing world problems, but 56 years ago, I came here as a student. Yeah, I was only 95 years. They had to check everything. I was so bashful. When we are in the medical field here, so we can do everything. Checked out my hair, eyes, or whatever it is. So I am not shocked, but I just want to place that in public. Thank you.
Yeah, unfortunately, we're getting a lot of, well, here's how I came over, here's my positive results. No, you work on that,
Yeah.
you know, and so they're able to come even though we know what they already have. So we're seeing a lot of latent tuberculosis, which, you know, is not contagious to the rest of us, but should they get sick, should they not be treated? Like I have a gentleman that's resisting treatment right now, and should he not be treated, he could become active and then we would have a big problem. I mean, he'd have a big problem, but the rest of us might have a big problem as well. So we try our best to talk to the latent TB patients. I meet with them personally with a nurse and we talk about the risks and benefits of treatment. And so far we've really had everybody say yes. So it's been a good thing. And it does seem like they already have some knowledge of what they're coming here with, you know, they know to expect a meeting and but it takes a lot, you know, like it's like Samantha's been trying, I like to meet with them and wrap up their treatment too and let them know that they're still going to test positive, but they have the certificate and it says they were treated and some of our staff spend hours trying to track people down and they need a translator as well, you know, so you have a translator ready, you can't track them down. You know, we've seen them from all over the place.
Yes.
Not just there. Yeah.
We haven't had any contact recently.
I don't think we've had anybody
Major
from there.
percent count.
Yeah.
I think there's 230 families now.
Mhm.
And you know, the treatment regimen is like the nurse has to call them daily and watch them take their medications. That does take a lot of our time.
You know, there's a big language barrier going on with these departments.
Sure.
How do we handle that here? We have a phone that we're using.
We have some handheld devices and we also have a phone service that we use.
I've had people walk up to me and answer their phone. Talk.
Which works most of the time.
What, you don't speak 7 languages? I'm shocked.
Quite a bit of fruit first. At first I didn't think it would work. Do your phone. Then we actually talked for some show up.
Very good. Okay. Well, again, thank you for that. Moving on. Financial reports. Ms. Teresa.
Good morning.
Good morning.
So a couple things I want to point out on the bills to you. On page 46, there's a bunch of zeros at the top of that page. We had a problem with a check run. The checks did not print because the printer became, it had an issue that spoiled those checks. That's why you see a bunch of checks with zero. They were all voided and then reissued when we got the printer to be able to print them. And then on page 47, you'll see Michigan Security Lock. That is the remainder of the balance to update the key fobs for the building. And everything else is pretty standard. I would be happy to answer any questions you have. There's bills both for September and October.
Move to approve the payment for the agency for September and October of 2024 percent.
We have a motion. Do we have support?
So,
Commissioner Matthews with the support. Any discussion? All right, seeing none. All in favor with an eye?
Aye.
Opposed, the same. Motion carries.
All right, moving on to the balance sheet. We do have quite a lot of money that we are going to be asked to send back to the state, but that's okay. We will send it back when they ask for it. We'll keep collecting interest until they do.
Very good.
So these are preliminary financials. We're still going through everything and making sure that, you know, we have everything coded correctly and finalizing the prior fiscal year. It does look like we were going to end up the fiscal year at just a little over 10% on budget. We did meet maintenance of effort, so we have no concerns about that. And there were just a few things that came in over. Agency support or 10 that came in over simply because the expenses weren't over, but we had more revenue that came in through interest on our bank account that we hadn't projected. We got more than what we expected. And so we had to leave more expenses in 10 rather than spread them out through indirect to the program. So the actual budgeted amount that we expected to spend wasn't over, but the program shows as being over because we had those expenses there. And then you will see RU24 is the underfunded pension. We were able to send the additional $50,000 to the pension fund that was not previously in our budget that you voted on at the last meeting. And that is why that one finished over. And then the dental clinic, there was an increase in the rent. And so that's a pass through. The dental clinic covers that, but we do have to look at. And then the children's special health care did not come in over it. It looks like it did, but you have to look at 325 and 112 together. And so it did come under as a group. And then we were just a slightest bit over in our recall, and we did some extra things to try to get that money spent this year. And we were just a little bit over, which will be covered by local dollars that were not spent in other programs. And same thing with 138 immunizations, just a skosh over. And we cover that with unspent dollars from other programs. I would be happy to answer any questions that you have.
Very good. Any questions? Yes, Commissioner Matthews.
thank you, Mr. Chairman. I have a question. How is your accounting department, the new employee doing?
Oh yeah, I'm glad you brought that up because I was going to mention that and I forgot. So things are going well in our department. Our new accountant, Jennifer, is starting to connect the dots. She's doing most of the day-to-day work on the financials. Now, we're still training on some year-end stuff, and she hasn't seen budgeting yet. I'm still doing the budgeting for the agency at this point. I haven't run on that yet because she's been pretty busy with trying to get everything else figured out. And the state eGrams system, she's going to get trained on that. Hopefully the end of this week, maybe not till early next week. But no, things are starting to click, and she's doing most of the day-to-day work, which is freeing me up to do some of my own work, which is fantastic.
Thank you, Mr. Chairman.
Any other questions?
Move to approve the month-end balance sheet financials as presented.
Good. We have a motion and support. Further discussion? Seeing none, all in favor with an eye? Opposed, the same. Motion carries. Thank you, Ms. Teresa. Committee reports. Finance Committee. Approve of the November 4th, 2024 Finance Committee meeting minutes. I move to approve. We have a motion. Any
Support. Thank you.
support? Further discussion? All right, all in favor with an eye?
Aye.
Opposed, the same. Motion carries. Program policy and appeals did not meet. Losers. All right. Going.
Somebody had scheduled that meeting on Wednesday morning after election. Just, nobody was thinking.
How much do you care about program policies and appeals? You guys care about it, right? Yes. Okay, moving to old business, health officers evaluation. Ms. Teresa gave us this, brought this. We actually discussed this at our last meeting. Commissioner Leininger asked to put it on there so that we can approve it, which I appreciate. We do have the evaluation in front of us. I will entertain a motion.
What would, I think, and again, in the minutes of the last meeting, there was a motion that came out of closed session to approve the $5,000
Merit.
form of merit pay, and I forget how that's set, but what was the,
Upon a satisfactory evaluation.
yeah. So I would move to approve the health officer's evaluation as presented.
Okay, very good. We have a motion. Any support? Charles, thank you for that support. Further discussion? Okay, very good. All in favor with an eye? Opposed the same? Motion carries. Thank you for that. 9, new business. Hillsdale Water Softener, page 53.
And Senator, I'm gonna move the table this at this time to allow the health officer to get a little more information on that. And the necessity of it.
Okay. So we have a motion to table it. We have support to table it. Further discussion.
None to be.
So, not debate, okay, we are tabling that. I'm assuming we have a good to vote on that?
Yes.
Okay, all in favor with an eye? Opposed the same? All right. It is tabled. Moving on. No, to B. PA 152, public employer contributions to medical benefits plans.
So finance did consider this information and Teresa has put this information together. So I would ask that she answer any questions that you have.
Okay. Any questions for Teresa?
Only question, Mr. Chair,
Yes, sir.
is that you had the opportunity to share with the finance committee.
Yes.
Thank you.
Okay.
I would move to approve the presentation for us for the agency to switch to or to use the hard cap figures for 2025 according to PA 152 for single $7,718.26, $16,141.28 for a couple, and $21,985 for the family.
Very good. We have a motion support. Any further discussion on the material? All right.
Just a comment, unfortunately, we're all seeing an increase in health insurance rates. The state of Michigan, in their infinite calculation of the hard cap figures, only saw a 0.2% increase from last year's figure in that hard cap, which is astonishing.
Yeah. All right. All in favor with an eye? Aye. Opposed the same? Motion carries. Moving on to C, employer-sponsored health insurance plan, page 62.
Also reviewed at the finance committee. The table on page 62 shows the proposed and the current. And Teresa also worked with our insurance agent to put this together, and she will be able to answer your specific questions.
Okay. Very good. Any motion on the employer? Do we have, yeah, for the employee?
I would move to approve the proposed Blue Cross Blue Shield of Michigan health insurance plans for 2025. PPO 1,500, 80%. The HSA 2,000, 80%. The HSA 3,500, 80%, and the HSA 6,350, 100%.
I will support that.
And I'm sorry, and include in that the Delta Dental and vision plans as outlined in this.
Yep.
Presented.
Sure.
I will still support that.
Okay, very good. You're not dying on that hill, the medical or the vision. Very good. Okay, we have a motion and support. Further discussion.
Just a highlight here. In the past, we had offered the employees, when we were on an 80-20 or even last year with a hybrid hard cap figure, we had offered them that via to a lower deductible plan. But if you actually did the math on it this year, it doesn't make sense for an employee to switch to that plan because it actually costs more to use the plan with paying the premium. To get that lower deductible, it costs you more than what you actually save by having the lower deductible.
Fisherman.
Thank you, Mr. Chairman. Projected $48,000 for the employer cost. I wonder if we have resources if that goes higher.
If that goes higher, we may have to make some tough decisions.
Further discussion. Okay, seeing none, we have a motion on the floor and support. All in favor with an aye? Aye. Opposed the same. Motion carries. Number 10. Public comment. No public comments. I did want to, before we went to adjournment, I didn't realize that Madonna was retiring. Give a shout out to Madonna. She is a phenomenal person, and I know personally has helped out family in an immense way, and appreciate all that she did for the health agency. So that was good. I hope her well in the retirement.
And for the commissioners on the water softener wholesale, I'm questioning why we need a water softener when we're on city water system. We have bids for softener, but no water thing. What the hardness is, what the softener is actually doing is a different type of water filtration system. Really, what we need there as opposed to a water softener. And the other thing, and I just talked about this, it's like you're an insurance agent, and you're sitting here, and you finally think about it. Is the water softener failed? What happened to it? Reach out to our insurance carrier because there's potential for it to be covered underneath what's called equipment breakdown. Right. One of us that have homeowners insurance, we have a heat exchanger cracked in our furnace. We had a water softener instead of the tanks. The fuses, fry in our fuse box. That's equipment breakdown. That potentially covered underneath the property.
Yep.
All right, and I'll also reach out to MCDC and make sure that whatever the results might come back, that it works for their equipment.
And again, I don't know what.
Yeah, I'll have to work with them and see what kind of testing we can get done.
Okay, very good. Well, I appreciate that. Please stick around for our education on the grant that was received. But outside of that, motion to adjourn, support. we have support for motion to adjourn?
I support.
By Commissioner Matthews, very good. Thank you. We appreciate that.
Thank you.
All in favor of the aye? Opposed, the same. Motion carried.